This is a huge achievement for me, and this was very difficult for me. Then I took subscription, and then I started my preparation. I was throughout my journey I was connected to Ellen completely. I was dependent on Ellen.
It's a really happiest moment for us, the team Ellen, as well as your parents.
Most importantly, you have to study pharma each and every day. In between, some gyno obs gyno question were also there in paper one also.
Very, very big congratulations, Dr. Subhashree, on clearing your FMG exam January 2024. And it's a really happiest moment for us, the team Ellen, as well as your parents. How do you feel after achieving this success?
Thank you so much, ma'am. I'm very happy, and I'm now feeling relief because this is a huge achievement for me, and this was very difficult for me because I am not a brilliant student. I'm always an average student, and this result is because of my hard work only, ma'am.
That's very nice to hear that, like even the average students, I do not call you as an average student. You have already become a doctor. So this exam was to just be eligible for the registration. And just tell me, how did you prepare and what are the tips you want to give to your juniors?
I started my preparation in first year only. At that time in 2017, there was no app. I was not aware about that apps and everything. So I started studying from books. Then I got to know about apps. Then I took subscription, and then I started my preparation.
Okay, that's really nice that you have started your studies from the first year of MBBS itself. Just tell me, what are the subjects which you focused most? And the preparation, how the Ellen has become a part of your this successful journey. Are you getting benefited, or you were benefited from the YouTube sessions of the teachers, test and discussions, PYQs, or the question paper series? Have you watched all those?
Yes, ma'am. I was throughout my journey, I was connected to Ellen completely. I was dependent on Ellen. I started my preparation from Ellen classes, live classes. Then I attended TND sessions of the Ellen, which was very beneficial, and it was covering all the subjects, all the topics, all PYT. It was covering all the previous year topics also, and it was very helpful. And it is due to CBOT only I could reach to this score, ma'am.
So, have you gone through the CBOT discussions which the teachers have taken it?
Yes, ma'am. Yes, ma'am. After the examination, I
Used to attend the live
yes,
sessions.
I
The
used to attend
teachers
the
have
live
taken.
session. And, yes.
Okay. Just tell me, what all subjects you focused most in the exam?
I focused on obs gyno, and then PSM, medicine, surgery, and patho and micro in the first.
What are the tips you want to give to those who are just very, very unfortunate not to clear it? I would say you should stand with them and you should always help them if they need your support. Any of the tips you want to give regarding paper 1 and paper 2?
Yes, ma'am. I would like to say that focus on PSM because it is very, very important. It consists of 30 to 40 marks approx, and don't leave micro and patho as well because it will increase your marks. And most importantly, you have to study pharma each and every day because it is very volatile subject. You will, if you will not revise it again and again, you will forget it. So read pharma. And for paper 2, I have to say you have to very sure about gyno. Because gyno is very scoring. Option gyno
How
is very
many
scoring.
questions came from obs and gynae? Because we have just taken the recall from the students, whatever questions they could recall, and I could just count there was around 35 to 37. But you are the student, you have given the exam.
Yes, ma'am. There was 30 to 35 questions, ma'am, short from obs and gyno, and it is, ma'am.
Some of the
only
questions
because
might
of,
be overlapping in PSM and
yes,
pediatrics
ma'am.
with gynae.
Yes,
Okay.
ma'am. It
What
is
about
because
the
of
paper
gyno
one?
only.
Actually, whenever I start taking the classes and all that, I always tell the students to focus on paper one, because paper one is the one which is, like giving you confidence, and paper two clinical to bacche kar hi lete hain. But it is the paper one which is pre and para subjects which, because they have read it in MBBS very early. So it's very, very difficult for them to recall
Revise.
everything.
Yes,
So I think paper 1 is very, very important. Paper 2 is a clinical paper where students can apply their clinical sense and knowledge to attempt those questions.
yes, ma'am. Because
What are the subjects of paper 1 and paper 2? You want to tell your juniors and your colleagues, those who were little bit unfortunate, to clear it out.
Yes, ma'am. In paper one, there was pharma, PSM, and there was micro and patho questions were there, and in between some gyno, obs gyno question were also there
In
in
paper
paper
one.
one also.
Okay.
Please don't leave any stone unturned. Complete each and every subject. You have to complete 19 subject because this is not an easy exam at all. You have to go through each and every subject, ma'am.
Okay. So that's really been nice, and looking forward that you should make your career, write your, like Philip, this UPSC CMS exam, which is already there. We have already released a video on UPSC CMS exam. In April, the form will be coming, and you can give, like exam in July as the exam date comes, and be ready for joining the LN next as a PG student.
Sure, ma'am. I would also like to add on that don't read 1,000 book one time. Read one book 1,000 times.
Okay. That's really very good advice, and thank you so much, and very big congratulations for
Thank
rest
you,
of your
ma'am.
life. Thank you.